Good afternoon and welcome to United TV. It is our Bariatric Friday session. So today we are gonna go into the heart of bariatric surgery with the bariatric surgery types. So we have done this session so many times as we are actually keeping them in our different playlists, topic-specific playlists. So, but what I have seen is every time we cover them, there are different angles that we capture, and then this is one of those that I'm hoping that it's going to happen. So Dr. Erkan is going to join me. Dr. Erkan, how are you doing?
I'm doing great, Kemal. Very happy to be back on yet another wonderful show.
Thank you. So, and I think we are okay on the sound side, so I can go on. I'm assuming, Ethan, right? We are good with the sound, so you're getting okay confirmation. So that I don't want to start again. So now, Dr. Erkan, we have done so many sessions together. So and we always start with the bariatric surgery types. And there are about 15 of them. I was just organizing our playlist and with the to-do list that we have. And then we, time to time, we cover different issues. We add them. And so the one thing that we know is bariatric surgery, regardless of the type of it, it's complicated. So just to kind of look into the different bariatric surgeries, gastric sleeve, gastric bypass, gastric band, which is less common these days, but it still is available. And there are some revision type of surgeries that's available. So, and I know those who are watching us, they can actually watch the other sessions with the same topic, so they can get more technical information, because I have checked this last night and we have done a lot of good work there. Mm-hmm. So today, for those who are actually looking for bariatric surgery, when they come to our office, they have their first consult. So what I would like to ask you is, what are the key differences between gastric bypass and gastric sleeve surgery? So if we can start with that.
Absolutely. So these are the two procedures that are most commonly done. As you mentioned, we do offer other procedures as well, including the non-invasive gastric balloon, but also the less commonly done lap band. But talking about gastric bypass and the gastric sleeve or sleeve gastrectomy, the main differences between the procedures is essentially the presence or absence of rerouting of the intestine. So if you look at the gastric bypass, there is division of the stomach, there is partition of the stomach, there is creation of a small stomach to receive the food. But in addition to that, there is rerouting of the intestine. In other words, the intestine, which is the part of the digestive tract that comes right after the stomach, is rerouted, given a new direction and a new connection when we do gastric bypass. On the other hand, with the gastric sleeve, the procedure is really only limited on the stomach. We divide the stomach and we take a big portion of the stomach out completely, reshaping the actual size and shape of the stomach. But the intestine is left in its natural state. It's not affected by this procedure. So really, the core of the difference between the two procedures is that with gastric bypass, there is rerouting of the intestine. With the gastric sleeve, there is no rerouting of the intestine, just partitioning of the stomach.
So on the gastric sleeve, the stomach pretty much stays in the same structure, but smaller.
Correct.
But on the bypass, just to bypass the definition of bypass itself, so it's bypassing actual stomach, and the stomach stays there, but not functioning.
That is correct. So the stomach, the greater portion of the stomach in gastric bypass stays there, and it doesn't receive food, but it still functions, meaning that the inside lining of the stomach still is active. It produces acids and juices which will be sent down the intestine, and then will be catching up with the food downstream.
Right.
Right? So the the mixing of the food and the stomach contents does not occur in the stomach any longer.
Right.
Right? That's the key difference between bypass and the sleeve.
So we do about 75% of the cases as gastric sleeve, and there are 20% probably is bypass, and still some band and some balloon
As well,
we
yes.
do. So why do patients often choose gastric sleeve over gastric bypass? And in some cases, why would they choose gastric bypass over gastric sleeve?
Yeah, so as you correctly said, the vast majority of patients actually come in wanting the sleeve as their first choice. And when they listen to broadcasts like ours,
Right.
when they read about the differences, the gastric sleeve seems to be intuitively appealing to patients because they feel, well, my stomach is big, that's why I'm eating a lot. So taking a big portion of the stomach will solve that hunger problem, and they see that. In addition, patients are wary about having the intestine rerouted. So if they can obtain the results that they're looking for with a procedure that entails less steps, less changes of their digestive tract, obviously they will gravitate towards that. So I believe a lot of patients will come in and ask for the gastric sleeve as their first choice because they want less changes in the natural order of things in their digestive tract. Conversely, there are some patients who ask for the bypass, right? Well, that is because there is a perception that the gastric bypass may give more weight loss. And is there any truth to that? There is, but the difference is not as big as many people think it would be in terms of the differences of weight loss between the procedures. Another reason why patients choose the gastric bypass may be because they are exposed to it more, having family members or relatives or friends who've had the gastric bypass and they were successful with that.
Or they're watching the wrong YouTube channel. So I want to actually kind of capture a couple of the questions kind of back to back. And one of them is you were kind of getting into it with the main benefits of gastric bypass compared to the gastric sleeve. From the clinical side, what are the main benefits of the gastric bypass?
Gastric bypass definitely has a much deeper impact on improving type 2 diabetes compared to the sleeve gastrectomy. In other words, if you look at what happens to the blood sugar level after both procedures, in some cases, blood sugar can normalize immediately after surgery in gastric bypass. Not in all patients, but in some patients it does, showing us that gastric bypass definitely has a much stronger impact on the correction of type 2 diabetes compared to the sleeve. Now, this does not mean that the sleeve doesn't affect type 2 diabetes. It does indeed, but the effect of the sleeve gastrectomy may occur after the weight loss has occurred as opposed to immediately. And there is some evidence also that the impact on type 2 diabetes may be much longer lasting with gastric bypass compared to the gastric sleeve. So one advantage of gastric bypass over the gastric sleeve is better control of type 2 diabetes. The second advantage is that with gastric bypass, people rarely have heartburn as a consequence of the surgery, whereas this can be seen with some patients who have the gastric sleeve. In fact, people who suffer from acid reflux see an improvement of that almost immediately after they've had gastric bypass. So gastric bypass has an advantage in terms of its impact on type 2 diabetes, as well as improvement of heartburn or acid reflux.
Now I'm going to reverse the question and ask you, are there any downsides to choosing the gastric sleeve over gastric bypass?
Really, there are no downsides to choosing it. There are very, very few situations in which one would say you must have a gastric bypass as opposed to gastric sleeve. One of them is when patients have a very significant history of acid reflux that has been going on for a long period of time, that may have required many types of medications to control, and that may have led to changes in their food pipe scarring, inflammation that are due to heartburn or reflux, in which case the gastric bypass may be better because of the downside of the sleeve in that situation.
So, like the one of them you mentioned with the reflux, we have certain process in place before actually they go through the procedure. Even if they decide to go with one of them, there are ways to prevent certain things ahead of time, and in some cases we change the surgery type.
Absolutely.
So, is there anything that we can actually identify this potential acids reflux issue for the patient and then change the procedure?
We can absolutely. For instance, people who've had a long history of acid reflux can develop changes in the lining of their food pipe known as Barrett's esophagus. Now, Barrett's esophagus is a condition that in a very small minority of patients can develop into cancer. In that situation, it is better to have a procedure that doesn't expose the food pipe to acid, and that procedure is the gastric bypass. So when patients go through the process and we do endoscopy, one of the things we look for is the presence or absence of changes in the lining of the food pipe. And in very few patients, sometimes we find that they had Barrett's esophagus, in which case we counsel them that the best procedure for them would probably be the gastric bypass.
And our care coordination team, they do flag those patients for us.
You do.
Well, you get the results anyway, but our process with the different clearances that we have in place, we are also seeing some of those and then just immediately communicate with the surgeon and with the patient. So now patients, they come to us with some decisions already in their head. And how do patients decide which surgery is best for them, other than watching the wrong channel, wrong YouTube channel?
I think it's all about education at the end of the day, right? We are caregivers. We're there to take care of illnesses and help to treat illnesses, but also we are educators, right? We have a duty to really educate patients about the options they have. And we obviously do not dictate which procedure a patient should have, but we have to show them what the options are, what the advantages, disadvantages of each option is, right? So very often the decision on whether to go with one procedure or another is a decision that is shared between the bariatric surgeon and the patient, right? And the very first consultation includes a very thorough assessment of the history, medical history of the patient. And based on that, based on the comfort level of the patients, that the discussion starts. During that discussion, patients will come up with a preference they may have. Very often, I find patients choosing one procedure versus another based on their exposure to these procedures through, as I said, for instance, what may have happened to friends of theirs or relatives who've had one procedure or the other. Now, our job is really to put that experience in the context of evidence-based medicine, right? We show them what the results are of one procedure. We show them what the results are of another procedure. And how would that apply in their individual situation? And that is the basis really for coming to a consensus between the bariatric surgeon and the patient about what might be best for them.
So another procedure that we do is gastric band. So, but we do a lot less these days. So why has gastric banding become less popular in time?
So really, it has to do with the experience we've had with the gastric band over the years. One of the main reasons the gastric band was popular in its time is because of the perceived reversibility of that procedure, right? It is something that doesn't leave a mark on the digestive tract, that doesn't leave something that is unchangeable. Well, that's not entirely true. because even placing the gastric band, although we're not taking out any part of the digestive tract, we're actually creating scar tissue around the stomach, scar tissue in the rest of the abdomen. So to say that the gastric band is completely reversible doesn't tell the whole story.
Mm-hmm.
But more important, when you look at the results of the gastric band, the results were mixed in terms of the amount of weight loss, but also the quality of life that people experience of the gastric band. I have to say that there are still some patients on whom we've placed a gastric band 20 years ago, and they still have the band, and they are extremely happy with the results. But there are many, many other patients who've come up and asked for their band to be removed because they haven't seen as good a result in terms of the weight loss, but also because their quality of life has not been really the one that they had wished because of regurgitation, throwing up, heartburn, and other problems that have arisen.
So I'm going to use this analogy, but I don't know if it's so stupid I can cut it off from the actual video, so you tell me. So it's like, you have a credit card, so then it's max. You don't have any more credit line left. So the gastric band is almost like someone is giving you another credit card without you taking care of this issue with the first one. Okay, so then now you start spending that just the way that you did with the other one, because all band is doing is putting a little band on your top of your stomach. So then the top part can still become like the bottom part in time if people are not following through our direction. So like you start spending on that.
That's actually a reasonable analogy. It is a reasonable
I just
analogy.
came up with that. So we can always take it out if it's if it's so crazy. So it doesn't like one of the things that we know with gastric sleeve, the part that we actually cut we remove from the stomach is the part that actually communicates with our brain and telling the brain that, hey, I'm so hungry. So with the gastric band, there is no advantage on that side because everything stays the same, right? So
that is correct. Although there is some evidence also that even with the gastric band, there is decrease in hunger, and there are some signs that communication between the stomach and the brain is also affected by the gastric band in a way that is helpful for weight loss. Now, we wouldn't go as far as saying that there is a full metabolic effect of the gastric band, but there is some evidence. So what I would like to clarify here, Kemal, is that clearly the gastric sleeve offers way more in terms of weight loss as well as quality of life compared to gastric band in general. But I do understand why some patients may be wary of having a portion of their digestive tract removed, right? That's something that psychologically may be difficult to accept for some people. And in my world, Kemal, the worst situation is for a person to do nothing about morbid obesity.
Right.
And so if the only thing they are comfortable having is the gastric band, I am absolutely okay to do that and offer education as well as support to minimize the downside of the gastric band. And if patients follow up and the instructions are really in place, they can be very successful with the band as well. That although their chances of success are much better if they were to have something like the gastric sleeve.
So in terms of, you mentioned whether or not any of these surgeries are reversible, perhaps just maybe the band, but with the scar tissue issue. But like technically, yes, we can take the band out.
Yes,
but
absolutely.
this is not the case for the sleeve, or this is not the case for the bypass.
Correct.
And then we know that those, especially patients with over 50 with diabetes, they should probably go with bypass. That may be because like they may not have another chance to do another surgery, but with the gastric sleeve for a younger patient, knowing that if they are able to handle the problem and deal with this chronic illness with gastric sleeve, That's kind of like our first choice usually.
It is. So that's another interesting part of the differences between the sleeve and the bypass, right? When you look at the gastric bypass, I explain it as a procedure which is the final stop procedure. In other words, there isn't really much option to do anything else surgically after gastric bypass. You've cut the stomach, you rerouted the intestine, and that's it. Well, on the other hand, the gastric sleeve is almost like a midway station, right? Where there is other things you can do afterwards. For instance, in some patients who have heartburn, which is really so significant of the gastric sleeve that doesn't respond to medications, you have an option to switch the gastric sleeve to gastric bypass. So you cannot do that with the gastric bypass, right? Other way around. So the gastric sleeve does give you options about what to do in case something needs to be done later on. With the gastric bypass, you don't have that option. It's almost like a final stop procedure. So my really explanation of the procedures is that if there are no compelling reasons for choosing the gastric bypass, like very severe heartburn with a lot of scar tissue, or type 2 diabetes that requires really a very strong procedure to address it very quickly, I think the vast majority of patients will do well in general with the gastric sleeve, right? It is a less intrusive procedure precisely because the intestine has not been rerouted. The intestine has been left in place. And this has important implications long-term because rerouting the intestine does have long-term implications in terms of absorbing vitamins, in terms of potential twisting of the intestine, and in terms of potential creation of ulcers at the connection between the intestine and the stomach, which are things you don't see after the sleeve gastrectomy.
Sure. So outside of these three, now there are some revision types we are going to cover in our revision episode. But I do want to also cover the gastric balloon. So patients who are watching, they can get all these four in one episode. What is gastric balloon?
So the gastric balloon is a unique, really, when you compare it to other procedures. And it's unique because the procedure is done without cutting any skin, right? It's done through the natural opening, which is the mouth, right? The patient is, of course, asleep when we do it, but we're able to insert a camera that we can direct into the stomach. And guided by this camera, we're able to deposit a big balloon inside the stomach. Well, this big balloon mimics the presence of food that creates fullness. In other words, after the balloon is in place in the stomach, the patient will feel as if they've just had a Thanksgiving dinner. They will not feel like eating because they will feel full. The appeal of the balloon is because it's non-invasive in this way. But the gastric balloon is not a permanent procedure. In fact, the balloon cannot be left in the stomach indefinitely. The stomach will invariably damage the balloon and corrode it in the long term, right? Or the balloon itself can damage the stomach if it's left beyond a certain amount of time. Currently, we say that the balloon has to be removed after 6 months. So whatever weight loss needs to be done needs to occur during that time. And one of the hopes is that with the person having had the balloon for 6 months, they may have been able to reset their perception of hunger and fullness that they can take on and continue after the balloon has been removed. In fact, in our program, we offer the balloon for 6 months, but the balloon program is actually a 12-month program where we continue offering nutritional counseling for 12 months total.
So these four surgery types, I think when our audience, they watch, they can get really good information from what we have covered from this episode and from the others. Now, one thing that we need to remind people that bariatric surgery is not a one-size-fits-all type of surgery. So it's going to be depending on the, as you mentioned earlier, depending on the person's history of different illnesses that they may have, different conditions that they may have, and their age, their gender, and with all those, it's kind of like a unique personal decision in a way. So then the best place for them to actually decide on this, where it should start is in the exam room of bariatric surgeon. So then they can start actually forming their opinion based on what they hear from the surgeon, what they hear from us, because we are a licensed channel on YouTube. So everything that we have provided on bariatric surgery is coming from our board certified bariatric surgeons. So, and this kind of would help patients to have a really a good process to decide what they should be doing. Now, coming with an opinion, sometimes like we hear a lot of things. People don't read; they look at the headline and they don't read the rest, and they make they form their opinions based on the headlines. So we encourage our patients to not to do that and be open-minded, listen to the clinical reasons why you should be doing this surgery versus the other one. But you mentioned earlier, the worst thing that you can do is do nothing.
Absolutely.
So, and that's why, every Friday, regardless of what's happening in the world, we are still here and provide knowledge and information to our patients and the other people who are looking for solutions for their problems. Dr. Gao, that's all I have for today. Thank you for your participation and providing the expertise that we need. This is a life-changing procedure, and we know, like one last thing I want to mention. So I have a project intern, and we are going through one of the projects on the weight loss and the issue of patients don't showing up for their appointments after their surgery. And there are 2 or 3 different incidents, and I'm sure she's watching right now. And I was trying to tell her why they don't show up. One patient lost 100 pounds in 9 months. The other patient lost about 150 pounds. In fact, I made a reference. I said, "What's your weight? Like you are like 125," and she lost more than your whole body in 12 months.
Yeah.
So then they don't show up for their follow-up appointments because they already went through a lot of things. But what we want them to make these things permanent. In order to make these things permanent, is to stay with the program and make sure that all these changes and the new habits that we have, new discipline we have, is already settled. So then this becomes a permanent fix, and then they can enjoy their life and not to go back to the old days. Well, thank you for joining us today.
Of course, my pleasure.
And we'll be back next week with another episode on bariatric surgery on Bariatric Friday. So until next week, stay united. Bye-bye.
Bye-bye.